let's start our today's video that is on cognitive behavioral therapy. So, cognitive behavioral therapy, that is CBT, is a type of psychotherapeutic treatment that help people learn how to identify and change the destructive or the disturbing thoughts pattern that have a negative influence on their behavior and emotions. Cognitive Cognitive behavioral therapy combines cognitive therapy with behavior therapy by identifying maladaptive patterns of thinking, emotional responses, or behaviors and replacing them with more desirable patterns. So, cognitive behavioral therapy focuses on changing the automatic negative thoughts that can contribute to it and worsens our emotional difficulties, depression, and anxiety. These spontaneous negative thoughts also have a detrimental influences on our mood. So, this is the exact meaning of cognitive behavioral therapy. I hope this is clear to you. Now, next, we'll talk about the types of cognitive behavior therapy approaches that addresses our thoughts, emotions, and behaviors. These can range from structured psychotherapies to self-help practices. Some of the specific type of therapeutic approaches that involve cognitive behavior therapy include first, cognitive therapy, next dialectical behavior therapy, that is DBT, next is multimodal therapy, and last one is rational emotive behavior therapy. Now, one by one, we'll talk about them. So, first we have is cognitive therapy. So, cognitive therapy centers on identifying and changing inaccurate or distorted thoughts pattern, emotional responses, and behaviors. Second therapy we have is dialectical behavior therapy, that is DBT. So, this addresses destructive or disturbing thoughts and behaviors while incorporating treatment strategies such as emotional regulation and mindfulness. Next therapy is multimodal therapy. So it suggests that psychological issues must be treated by addressing seven different but interconnected modalities, that is, behavior, affect, sensation, imagery, cognition, interpersonal factors, and drug or biological considerations. Next therapy is rational emotive behavior therapy. So this involves identifying irrational beliefs, actively challenging these beliefs, and finding learning to recognize and change these thought patterns. So these are the various type of cognitive behavior therapy. Now let's talk about the cognitive behavior therapy techniques. So CBT is about more than identifying thought patterns. It uses a wide range of strategies to help people overcome these patterns. So here are just few examples of techniques which are used in cognitive behavior therapy. So first we have is identifying negative thoughts. So it is important to learn what thoughts, feelings, and situations are contributing to maladaptive behaviors. This process can be difficult, however, especially for the people who struggle with introspection. But taking the time to identify these thoughts can also lead to a self discovery and provide insight that are essential to the treatment process. Second, practicing new skills. So in CBT, people are often taught new skills that can be used in real world situations. For example, someone with a substance use disorder might practice new coping skills and rehearse ways to avoid or deal with the social situations that would potentially trigger a relapse. Next, goal setting. So, goal setting can be an important step in recovery from mental illness, helping you to make changes to improve your health and life. During CBT, a therapist can help you build and strengthen your goal setting skill. And this might also involve teaching you how to identify your goals and how to distinguish between short and long term goals. It may also include helping you set a SMART goal, that is, specific, measurable, attainable, relevant, and time based goals, with a focus on the processes as much as the end outcome. Next, problem solving. So, learning problem solving skills during CBT therapy can help you learn how to identify and solve problems that may arise from life stresses, both big and small. It can also help reduce the negative impact of the psychological and physical illnesses. So, problem solving in CBT often involves five steps. First step is identifying the problem. Second step is generate a list of potential solutions. And third step is evaluate the strength and weaknesses of each potential solution. And fourth step is choose a solution to implement. And last one is implement the solution. Next is self monitoring. This is also known as diary work. Self monitoring is an important CBT therapy technique. It involves tracking behaviors, symptoms, or experiences over time and sharing them with your therapist. Self monitoring can provide your therapist with the information they need to provide the best treatment. For example, for people with eating disorders, self monitoring may involve keeping track of eating habits as well as any thoughts or feelings that went along with consuming a meal or snack. So, this was all about the CBT therapy techniques. Now, next, we'll talk about what CBT therapy can help with. So, cognitive behavior therapy can be used as a short term treatment to help individuals learn to focus on present thoughts and belief. CBT is used to treat a wide range of conditions, including addiction, anger issues, anxiety, bipolar disorder, depression, eating disorder, panic attacks, personality disorder, phobias. And in addition to mental health conditions, CBT therapy also have been found to help people cope with chronic pains or serious illnesses, divorce or breakups, grief or loss, insomnia, low self esteem, relationship problems, and stress management. So next, we'll talk about the benefits of CBT therapy. So, the underlying concept behind CBT is that thoughts and feelings play a fundamental role in behavior. For example, a person who spends a lot of time thinking about plane crashes, runway accidents, and other air disasters may avoid air travel as a result. So, the goal of CBT therapy is to teach people that while they cannot control every aspect of the world around them, they can take control of how they. So, CBT is also known for providing the following key effects, benefits. First, it helps you develop healthier thought patterns by becoming aware of the negative and often unrealistic thoughts and dampens your feeling and moods. Secondly, it is an effective short term treatment option as improvements can often be seen in 5 to 20 sessions. Next, it is effective for a wide variety of maladaptive behaviors. Next, it is often more affordable than some other types of therapies. And it is effective whether therapy occurs online or face to face. And it can be used for those who do not require psychotropic medications. So, in today's world, CBT therapy is one of the most well studied form of treatment. It has been shown to be effective in the treatment of ranges of mental conditions, including anxiety, depression, eating disorder, insomnia, obsessive OCDs, that is obsessive compulsive disorder, panic attacks, panic disorder, post traumatic stress disorder, and substance use disorder. Some researchers had indicated that CBT therapy is the leading evidence based treatment for eating disorder. CBT has been proven helpful in those with insomnia as well as for those who have a medical condition that interferes with sleep, including those with pain or mood disorders such as depression. CBT therapy has been scientific CBT therapy has been scientifically proven to be effective in treating symptoms of depression and anxiety in children and adolescents. CBT therapy has a high level of empirical support for the treatment of substance use disorder, helping people with this disorder improve self control, avoid triggers, and develop coping mechanism for healthy stresses. So, in conclusion, I want to say that CBT is effective in treating a wide range of mental health issues, including depression, anxiety disorder, post traumatic stress disorder, and substance abuse. It is often used for short term focused treatment. So, if you find this video informative and helpful, please give it a thumbs up and subscribe for more content related to health and well-being. And if you have any questions or personal stories to share, feel free to leave them in the comment box below. And let us continue the conversation. Time, take care, and remember. So until next time, take care, stay safe, and stay healthy. And that's it for now. And thanks for watching this video.